In 3 days' time, the country will mark 100 days of the new coronavirus that has dealt blows to different sectors, both economically and socially. Following testing of 2,518 samples, 184 people tested positive, being one of the highest infection rates of more than 7%. The new number pushing the total infections to 4,044 cases. Out of this, 1,353 have since recovered and been discharged from hospitals and isolation centers, while 107 have died. From the outlook, though, the future is grim. In June's 17 days, 2,082 cases have so far been detected, a number higher than any other month since March. A daily average of 122 cases, the start of the approach to the peak.
All indications are that we are now probably entering into the exponential phase of our curve, which is the steep rise phase of our curve.
Away from the recoveries and fatalities, 2,584 patients are still nursing the virus, but only 548 are admitted at different hospitals across the country. This meaning that more than 2,000 persons that have tested positive are either nursing from home, are unknown, or could have provided wrong contacts and therefore untraceable. Since Monday this week, 450 people have tested positive, but less than a third have so far been admitted in hospitals.
As of the data we had this morning, out of this number, about 120, 130 had been admitted, and we'll be able to collate the figures after getting all the information from the rest of the reports from the counties.
Most of the admissions are at the Kenyatta University Teaching, Referral and Research Hospital, which has 98 patients, 5 of them in the ICU. Alupe Hospital in Busia County has 83 patients, while Nairobi Hospital has 18, 3 of them in ICU, and 2 more ICU patients at the Aga Khan University Hospital in Nairobi. Of the new infections, Nairobi carries the heaviest burden at 111. 12 other counties reported less than 20 cases each. In Nairobi, Westlands constituency appears the new burden, having recorded 33 new cases. Kibra, Langata and Embakasi East constituencies have 19, 18 and 15 cases respectively. Health officials puzzled by the trends.
If we slacken, if we begin to fill up our matatus without any respect to the distancing measures that we have put in place, if we begin to congregate and meet in places, we will certainly see an increase in numbers.
CAS Rashid Aman has also cautioned Kenyans against taking COVID-19 tests at non-accredited facilities, emphasizing that for now, the only recognized diagnosis for COVID-19 are methods that use real-time PCR tests conducted on specimens collected from the respiratory system. The rising COVID-19 curve portends a risky situation for the country's health system. Authorities now counting on the high proportion of patients exhibiting no symptoms as they would need little or no medical attention. Sam Gituku, Citizen TV, Nairobi.